Hello everyone, my name is Daniel Gomez Quijas, and as you guys can see, I will be talking about the relationship between lifestyle and stroke. The objective of my presentation is to show you guys how lifestyle directly affects the risk of a stroke and its long-term effects. First, let's start by discussing the importance of recognizing the symptoms of a stroke. Some of the first few signs are facial drooping, where we can see that one of the eyes or part of the face starts to sag. Another one is that arms or arm become weakened, meaning that the person can't really hold like a cup of water, as we can see in the picture, or a cup of coffee. Uh, Speech can also become slurred, meaning that you person won't be able to express themselves correctly. Uh, Time becomes essential to increase the likelihood of survival, since the affected areas in the brain are being starved from oxygen. As we learned in one of the last lectures, there are two main types of strokes, one being an ischemic stroke and the other being a hemorrhagic stroke. An ischemic stroke is caused by a blockage in an artery. As we can see in the picture, it can be due to a buildup of plaque or a blood clot getting lodged within an artery, causing brain tissue to die due to the lack of oxygen. And the likelihood of having this type of stroke is about 70%. On the other hand, a hemorrhagic stroke is caused by a ruptured artery, like we can see in the picture, and this is due mainly to an aneurysm, which can weaken the walls of the artery. And the likelihood of having this type of stroke is about 30%. So, what are some factors that can increase the risk of having a stroke? According to a study done by Quiñones et al., it was shown that having obesity due to a high diet of fatty foods increases the risk by 5% per BMI, or body mass index. The normal BMI is between 19 and 25 for a healthy person. For every BMI point that goes over 25, the likelihood of having a stroke is increased by 5%. In another study done by Piloto et al., it was shown that having hypertension or high blood pressure is increases your risk of developing a stroke by 70 to 90%. In the same study, it was shown that having diabetes also increases your risk by 35 to 60%. Having a heart attack or a history of heart problems increases your risk by 10 to 56%. The use of tobacco products uh, increases your risk by 14 to 28%. And lastly, the use of alcohol increases your risk by 17 to 21%. What are the consequences of suffering a stroke? As mentioned by the American Stroke Association, some of the results of having a stroke are death, paralysis in parts of the body, problems with motor coordination, vision problems, dementia, seizures, hearing problems, and developing aphasia. There are three main types of aphasia, the first being Broca's aphasia. People who suffered a stroke in this area of the left hemisphere tend to have a hard time producing speech. The second is Wernicke's aphasia, which people who suffered a stroke in this region of the left hemisphere have a hard time understanding and processing speech. And lastly, global aphasia is where the entire left hemisphere of the brain is affected, which is critical for forming speech. Lastly, bringing it all together, it is extremely important to act fast once we realize that somebody is having a stroke. Also, as shown in a study done by Brady et al., uh, treatment should be guided towards the rehabilitation of motor coordination and communication, especially for patients with aphasia. Lastly, a healthy lifestyle prevents or diminishes the risk of having a stroke and suffering from the effects. Here's a list of all the references I used for my presentation. And thank you for listening.